Welcome to the office.
Welcome to the office.
Thank you.
How can I help you? What brings you here from Seattle?
It was, say, my hip area.
Okay.
So it's tight, and so it's, as I get older, it's getting worse. So
What happened?
oh my gosh, I don't know. It really started in '03, but when I went to one
Back in
doctor.
elementary school?
Exactly.
Okay. What happened in '03?
It
Started hurting?
No,
or
it's true. I was working in the art, and my right side went numb.
Right arm went numb?
Yeah,
or the whole?
my right arm went numb, and
Okay.
so obviously I got concerned. Went to the doctor. Was nothing wrong with my heart and anything like that. So he sent me to a neurologist, and so he actually said that the nerve system can get like a virus, right?
Okay.
Yeah, and so ran tests, blood was fine. So he said just in time it'll go away. So it did. So then what's interesting, I noticed at that point, depending usually.
Hold on, the nervous system can get a virus.
That's what I was told.
I know of one called herpes zoster. Does that sound familiar?
No.
Where it's basically the herpes virus that hits the nerve root.
Okay.
And that usually causes excruciating pain.
No, it wasn't painful. It was just literally, it was numb. So if I'd be, because I fly a lot, and also if I'm driving, then literally the arm would go numb.
Okay.
So then I would have to change the position, the way I was sitting. And so then the numbness would go away. As I'm getting older, you could tell the weakness is there, right? So as I think I'm getting stronger, then you can tell the weakness in the hip from, if I stand and I keep my feet planted, if I rotate, right, then I can feel some, pinching sensation.
Okay.
And then I can tell my left, it was crazy, I'm right-handed, but my left leg is what's dominant, so I kick with my left and things like that. So I know it's overcompensating
Goofy
for it.
foot,
Yeah, exactly.
so to speak.
Yeah,
Okay.
so
How's the numbness?
that's gone.
And
So-
you can't trigger it?
No, I can't trigger the numbness, but what I can trigger is if like I said, if I'm standing and I'll keep my feet planted and I rotate, then I can get it to twinge, right? And then I'll feel it, all the way up and down.
Up and down, up down to the toes or
Yep.
down to the ankle?
Down to, all the way down to my foot, to my ankle.
Okay, and
Yeah.
then up to where?
Up to right here. So right
Got it.
there and then down.
And so this is what's interesting, what you're describing. This follows the inguinal canal or the inguinal L1 ligament, but more so when people start to complain this way, it's usually hip related.
Okay.
But when we're talking about an SI joint, which is the pelvis and the sacrum, right? The SI joint, that usually doesn't refer down to the foot, usually. So it could be two things going on,
Okay.
or it could be one,
Okay.
and we'll figure that out. And that's the number one. That's
Yes.
number one is the hip.
Correct.
Any other issues going on?
No, so what I notice is, so if I'm, usually I start on my back when I sleep, and if I will rotate just in your sleep, and so occasionally, depending on what the leg's doing, that twinging, if you will, right, will wake me up. So I'm thinking, okay, great, then that's obviously crazy.
Twinging in the hip, not the up and down.
No, just as if I'm laying, if I rotate, then all of a sudden, if I rotate wrong, it'll wake me out of the, sleep. So that's why I thought, okay, I need to do something.
Okay, so here's what we'll do. Let's go over your films.
Okay.
Let me tell you what I see. Before I look at the numbers, let's look at the whole foundation here and let's see what we see. Hip sockets are good. I'm happy with that. One thing I do see, we see a lot of, you see this is the ilium. You see the ends of the bones. It looks like there's little pieces coming out there, right? That means you played hard.
Okay.
Okay, so that's just those are the tendons that connect to or not the tendons, the ligaments, right?
Okay.
Tendons and ligaments. So just a little bit of moving around there. But here's the first thing that pops up that I see. We have a kink here in the tailbone. That's the first thing I see. And I've had quite a few cases of tailbone coccyx even that can refer that hip pain. Okay? That's one thing we're going to look at. When we look through the SI joint here, we can see through it good. It's a little fuzzy in there, but I can see through the joint. This side, same thing. I can see through the joint. There's a little more scar tissue on the right SI joint than there is on the left SI joint. When we look at the sacrum, and we'll go on the side profile in a second, this is what I want you to see. So this is L5, S1, S2, S3, S4, S5. And then we're down in the coccyx. What I want you to see is this. So I'm drawing the plane lines. You see what I'm showing you here? So down low, it's bent that way. But the sacrum, the tailbone, is bent to the left. So we have a rotated sacrum on the left side. It's dropped 2 millimeters on the left. Follow the process. It's labeled both iliums, or we're obviously going to find it on you, but it does tell me the way it's misaligned, this is due to some sort of old trauma.
Okay.
Why do we know this? SI joint and the way the SI joint moves. It moves as, the SI joint is known as an auricular surface. The auricular surface is an irregular shape, right? Just like the auricle of the ear. And when we look at it, it does this. So I'm referring the medial aspect here with the sacrum there. When it goes down, when it misaligns PI, it naturally is going to go out. I'm referencing the inside there. When it goes up, it wants to go in. ASIN, PIEX. You have a PIIN. So it goes against the normal movement of the SI joint, tells me trauma. Was it left or right? We'll find it on you.
Okay.
But let's put it a little bit together in terms of what the left side is doing, since the rotation is on the left. The left pelvis goes down and it turns in. The sacrum on that side turns left, so your overall body favors to the left. But look at what your spine's doing. Your spine wants to go which way? To the
right.
To the right. But here's the interesting part. This situation is causing a little bit of this kink in the curve. Tiny bit. Now let's go back to the full spine here and let's see what it does. It goes to the left. The body's going to do what? It's going to compensate to come back to neutral. That's based on what we call the righting reflex. Body's going to do everything to keep the head straight and the eyes level. Comes back to neutral here, up here, and then we have a little bit of a kink going on up here. That's in the upper back here, okay? And again, trauma, posture, kind of going together. I'll deal with whatever I find in terms of nerve pressure, right? We're not fixing kinks in 4 days. But here's the other thing. My business isn't here to try to straighten out a spine anyway.
Yeah.
My business is, let's get it. Do we have a level base and foundation, number one? And do we have the right side curves? How is our posture? And when we look at your posture, there's a lot of good news here. Curve in your low back is decent. I'm okay with that. However, there's a little bit of a sway back, and what I've done, I even offset the cervical slightly forward, okay? And we're still sway back. So what happens from the sway back is that the muscles are compensating and working overtime just to keep you upright. So I know you got stuff going on here. One is the posture of being behind, two is the kink. With that kink, what's really important in your case, and with anybody who has any kind of curvature on the AP film, your posture, driving, sitting, any of that, you should not be going back more than 19, we say 19 or 20 degrees.
Okay.
Or riding a bicycle going forward, we don't want to be forward more than 19, 20 degrees. That's your window.
Okay.
You go forward past 20 in a sustained position, the kink gets worse. You go back in a sustained position more than that, the kink gets worse. Okay?
Okay.
The good news is, we figure out the foundation, and then you got homework. And what's happening in the top, two things, as a result of one, whatever trauma there was, and two, we're starting to get that straight neck and a slight reversal in the neck here. And that slight reversal will do what? Our curves were designed to have 60-degree reciprocating curves. So this is the front of the body, this is the back of the body. 60-degree forward curve in the neck, 60-degree in the back, and 60-degree forward. 60, 60, 60, that's our first line of defense against the forces of gravity. We lose the curve for whatever reason, let's go sway back and kink, and then what happens? We don't have it, so what just
Correct.
took it? Here.
Yes.
Okay? So the idea is we want to retrain the body,
Okay.
okay? And that's why we don't want to start doing weights right away. And a lot of people ask me, and by the second, third visit, like, okay, can I go to the gym? It's not about the gym, okay?
Yeah.
We'll get there. When I look here, this is an old whiplash injury, a couple of whiplash injuries we had. Whether it was car related, whether it was bicycle, whatever it was. The discs are still good. This one is a little bit less, you can see. This one is a tiny bit less, but this one is less. Why? Because it's part of it's straight and it's starting to go in the opposite direction.
Okay.
So the key is going to be, and we'll talk about sleeping positions and ergonomics, and we'll talk about all that, okay?
Okay.
Ideally, you want to be sleeping on your back. You should not be using a pillow.
Got it,
Using a
okay.
pillow is just going to make it worse.
Okay.
So you can do the towel, fold it, roll it, tiny bit, not a huge bath towel, under the neck, and start to train it.
Gotcha.
That's going to take at least a year.
Okay.
So don't think you're getting adjusted for a year to get a curve back.
Okay.
Okay? And don't let anybody tell you that. Anything else I need to know about you here? Digestion is a little bit off, dude.
Really?
I do have to say it. And if you go back to the vids, we look at the Megan Blasies right there. It's that dark little bubble right there.
Mm-hmm.
This thing should be this big. And then when I look over here and the factors I did, I shouldn't be seeing so much of this stuff. You can see this is all undigested food, ascending colon, transverse, and descending. But there's a lot of undigested food in your colon, dude.
Wow.
Okay. When we look at the tailbone, and let's look at the low back, we are designed to have level parallel discs. We can see the disc is still good. It is a little bit less in the back, but it's still good. 4 is good, 3 is good. Now, this stuff looks off because it's compensating. There's that little curve in the lumbar spine. There's a point I'm making here. This one is tilted back, tilted, 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 all the way to there. 5, 4, 3, 2, 1, 12, 11, 10, 9. So everything from your L5 up to 9 is all compensating from your tailbone.
Got it.
Okay? Meaning sacrum, or it could even be the pelvis. We want to really focus, this trip is the foundation. That's number one. Okay? 2 millimeter measure difference on the left. It is what it is. Here's the interesting part. The MD, not the medical doctor, the measure difference. The MD is the telling us that the left is 2 millimeters lower than the right. Okay. Now, the AD is if this is functional related to the pelvis. Oh, this is interesting. I threw my whole game off. Okay, if this threw me off. If I adjust your pelvis, I don't change that.
Okay.
And that's fine. It's under 7 millimeters, adjustments will hold regardless. So what's kind of throwing me off here, Phil, is that there was a hip trauma, and you are complaining of hip symptoms, but I don't know the hip is causing your specific. I think it may be a piece of the puzzle.
Okay.
My suspicion it's down in this area, in the tailbone. Okay?
Okay.
And what we'll do is for 1 or 2 adjustments, we're not touching, hopefully we don't have to touch the pelvis, and we'll see what happens with adjusting whatever we find in the foundation first.
Okay.
Okay? And if it's there, it's there. But this is interesting because I see no change happening in the MD. Okay, this is going to be a fun case. Even though it looks so simple, guys, you look at it, it doesn't look like a lot of misalignment. It's actually a complicated case. But we'll figure it out, okay? Now, you said that, what was the adjustment that gave you the relief in that hip from the beginning?
Well, when they measured, he said
Did he measure on an x-ray or did he measure on the outside?
on the outside on the table, I was laying flat, right, and just brought the legs together and said that your left leg is an inch shorter than your right leg.
Okay.
And so then,
Well, he did good work then because it's only 2 millimeters now.
yeah,
Right on.
Yeah.
Good job. Okay, you ready to get started?
yes,
Questions?
no,
Let's do it.
okay.
And that hip is hurting that bad that you had to come down here?
Well, it's like now it's fine, right? But it's just like I said, if I stand here and I do this, right, then it starts to get little let me know that it's there, and then working out, especially when I'm doing squats, right, then it'll remind me of what's going on.
Got it.
But just normally it's fine.
Okay, keep
Yeah.
walking. So he doesn't actually move through his SI joints. He kind of walks side like this when he walks. Turn around, Fizz. Let's watch this. And first thing I want you to do is march in place. Okay, go ahead and walk towards the door, please. You always walk with your feet out like that?
Yep, normal.
That's your norm?
Yeah.
Okay, no, I'm just asking. So there's an upper cervical issue going on too. And that's as far back as you can remember?
Yes,
Mama dropped you?
that I don't remember.
Mama, you drop him? Keep walking. Sorry. Okay. All right, now we're gonna mimic or recreate what you were saying. Face the x-ray that way.
Okay.
And so we said the left side goes down and in, sacrum goes to the left. And which way do you have to turn to?
So if I turn like,
So he's
if
going-
I'm planted like this.
Yes, and
And
he's
the person-
going more to the left.
Correct, right?
But
So
you
then,
feel it on the right.
correct, exactly.
Okay,
Yes.
interesting.
Yes.
All right, have a seat over here, please. What if it's the left side that's the issue and the right side is the compensation? That would be interesting. Yeah, 20 points up top, C1, left side. Interesting. He has cord pressure. Sir, you got cord pressure. You heard me talk about cord pressure before? Starting at the atlas, the needle is sticking the whole way down the left side. I have to work on the upper cervical first, sir.
Okay.
Have you walk and then retest everything.
Okay.
Let me show you what it's doing. So this is the upper cervical mechanism. Put your fingers in there, please. 2, 3 fingers, nice and snug. And so if we have turning of the upper cervical, you can feel what it's doing to your fingers.
Yep.
And if I'm just moving it around so you feel it. That your fingers represent the spinal cord, so it's causing a little bit of tightness up there, going all the way down.
Okay.
And the reason we talked right before we examined you. Anybody who walks bilateral toe out, that's their norm. Innately, that's the bottom, and that's in lieu of any structural abnormalities or anomalies.
Yeah.
This is the body innately trying to hold balance from an upper cervical issue.
Okay.
Someone who has bilateral toe in walks like this, or that pigeon toe type thing, is usually a sacrum issue, or they don't tie their shoelaces.
Okay,
That's
got
one
it.
or the other. Okay?
Okay.
So what we see here, C2 is wedged on the right, C1 is wedged on, of course it is, C1 is wedged on the left. C2 is a PRS, C1 is going to be ASLP. Okay. Okay. Turn left, turn right. Bend right, bend left. Relax there, please. We're going to set C2 lightly, very, very light, just to get it stable for C1. Go ahead and put your feet out, please, on the heels. There you go, palms up, resting on your thighs. Shoulders relaxed back. Good. There you go. Nice. Clunk. There you go. You good?
That's great.
All right. Nice and easy there. Left ear down. There you go. Home run. Let's walk that off a couple of times.
Okay.
That was nice. It's,
That's crazy. My head got lighter.
it's good, right? Keep going. Oh, walk on your toes, please. Regular walking one last time and then have a seat. Good. Let's have a seat over here, sir. Now let's check everything. You know what's interesting? I don't know that there's another way to find cord pressure like that. You know, it kind of trips me out. So like without, I mean, it's just me. It's like without the meter for me, I mean, we can work with people, no issue. But like, what if there's cord pressure there and we're working on all this other stuff and that thing is still there? Come here and check it out. So we're clear now. 20 points is gone. Now let's see what shows up. T7, left side. All right, that's around L1, L2. L1 can be that too. Remember we said L1 first thing? That was interesting, and that was on the right. And I got it on the right, hey! Now, let's see, there it is. S4, 10 points down low. S4, L1, T7. 1, 2, 3, 4, 5. 6 more tender, 7 more tender. 6, 7. That's the part of the digestion too. 6, 7, 8, 10, 11, 12. Sit up a little straighter. Oh yeah. Back slowly towards me. Number 5. number 4, 5, try that again, 4, 3, 2,
Yeah.
1, 2,
Yeah. Yeah, that one's there.
2.
Yeah.
5, let's go down now. 1, S1, S2, S3, S4. I feel it right there. S4 or S3?
S3.
S3, L2, T6. Didn't expect that combo. Let's do it. So 6 and 2 are both PLI. S1, S2. Okay, and S3 is the thing that's tilting it down on the left side. Okay. I'm cool with that. Let's do this. You ready?
Perfect.
So we said it's down a little on that left. 1, 2, 3. We're going to torque clockwise to bring it up. Relax the shoulders, please. That's a piece. Gotcha. Nice.
That's great.
You okay?
Perfect.
2, 3, 4, 5. PLI between 7 and 2. I'm going to do 7 first. Have you walk, and then we're going to do 2 on the knee chest table.
Okay.
2, 3, 4, 5, 6, 7 PLI. There you go. Nice. As you're walking, tell me if anything is different for you.
Okay, is it just me or my feet straighter? It's crazy.
Yeah, they're straightening up. That's pretty cool.
That is pretty cool.
That's pretty cool. That's pretty cool. Keep walking. So your homework while you're here, you know, right? 10, 12, 15,000 steps. You walking
Okay.
as much as you can.
Okay.
I mean, you look like you're pretty quick regardless. So you just keep walking, please.
Okay.
Doo-doo. Six is clear. A lot of shifting. 2 is still there. Let's feel this first. 5, 5, 1, 2. That's 3. Let's go on the knee chest table, please. Black table over here. L2 is a PLI. I'm going to cross over on this one. Relax the hands. Right over here. Palms up. Tummy down, sir. There you go. Tummy up. 5, 4, 3, 2. Gotta get all that tissue out of the way. Drop the tummy down, sir. Down, 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 down. Nice. Home run. That was beautiful. That was beautiful. You good?
Yes.
Step away from the vehicle. Let's walk it out. Good stuff. Yeah, your left foot is straightening up. By the way.
Yeah, that's crazy. I can see my toes in front of me, not to the side.
Mm-hmm. Well, we'll see tomorrow what happens. Hey. Okay. Walk on your toes. That should be easier. Regular walking.
Yep.
Can you stand and face your x-rays, please? I want you to twist to that left side as much as you can. See how that feels in the hip.
Yeah, that's crazy.
Turn around. What?
Can't feel it. That's nuts. That's been like forever.
There you go.
Wow, that is absolutely insane.
What's
Seriously.
What?
There's nothing there anymore.
Show me here.
Seriously. So if I do this, right, before you did the adjustments, if I do that, I could feel it. Now there's,
You golf?
no.
Because that's a golf swing you're
Yeah,
describing.
but that's
right?
crazy. That really is crazy.
Try the other way, please, just to see how the movement is. Can you sit on the floor?
Yeah.
And legs crossed. Twist your body left.
Yep.
Twist your body right. A little different, yeah?
That's crazy.
Oh, that's crazy. Oh, that's crazy. Have a seat, sir. Head down. Well, that's why you came here.
That's true.
It did not follow a normal pattern. And by the way, adjusting your pelvis doesn't really do anything for you. And something may happen down the road, because now as we start to change this, it's going to change the whole mechanics.
Makes sense.
Okay? And nice. Clear. 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 May I tune up a couple other things for you?
Please.
Ears. Shoulders. Let me do the work. Don't help. Oh. Don't help. Nada. Let's go on your back here. And left leg up. AS talus. There you go, sir. So, we did S3, L2, and... oh, we did a lot, actually. S3, L2, T7, and upper cervical. Squeeze. That's good. Squeeze. Hands are good, dude.
Okay.
We'll deal with jaw and septum tomorrow, next visit.
Perfect.
Questions?
No, this is great.
Welcome to the office.
Thank you. It was a pleasure.
Pleasure.